Good day, my name is Adebisi Benjamin Temidayo from Osun State University, Nigeria. First off, I would like to appreciate the organizers of this program, the School of Law at the University of KwaZulu-Natal, for acknowledging my work and giving me the opportunity to present my research on building a formidable artificial intelligence framework for healthcare in Africa, the pros and the cons. I have my outline. I will start with the definition, talk about the history, artificial intelligence in the health sector, the benefit and the risk, and lessening the risk, the dangers associated with the use of artificial intelligence in healthcare, the challenges Africa will be facing or is facing presently, and I will conclude with my notes. Now, what is artificial intelligence? Artificial intelligence involves the simulation of human intelligence processes by machine, especially computer system. With increased technology, we must learn how to learn new things and apply them in our day-to-day endeavors. Thus, the application of artificial intelligence become imperative in the healthcare sector. The history of artificial intelligence. Since the 1940s and the 1950s, there has been interest from several scientists in several fields to create an artificial human brain. The beginning of artificial intelligence can be traced to classical philosophers who attempted to describe human thinking as a symbolic system. By 1956, the term artificial intelligence was, however, coined in the academic conference in Dartmouth College in Hanover, New Hampshire. In 1970, there was the first attempt to implement artificial intelligence in healthcare, where Dendra, that the technology used, was introduced at the Stanford University at the United States of America. Artificial intelligence in health sector. Artificial intelligence, also known as AI, in healthcare is an overarching term used to describe the use of machine learning, algorithm, and software to mimic human cognition in the analysis, presentation, and comprehension of complex medical and healthcare data. AI technology differs from other traditional technology in healthcare in the profound ability to gather data, process it, and also in giving well-defined output to the end users. Thus, AI simulates the human intelligent processes by machine, especially computer system. What does artificial intelligence have to offer? AI in health sector promises diagnostic processes, treatment protocol development, drug development, personalized medicine, and patient monitoring and care. We also have the potential benefit of AI in healthcare in the following ways. AI is going to assist in healthcare triage in case of pandemic such as we have in COVID-19 to set priorities in disease severity. In such cases where we have limited resources with several diseases. So the AI is going to help us to set priorities. Which disease should we attempt first? AI will support management decision making. We automate daily tasks, process and analyze huge amounts of data. AI will be useful in image scanning and segmentation for easy analysis. It will be used in integration and improvement of workflow, prediction of disease risk and spread. AI will be useful in patient appointment and treatment tracking. AI promises to increase productivity by over 300%. Then there's also hope to minimize human error, reduce fraud, and optimize diagnosis by close to 100% accuracy. AI is also going to be useful to create algorithms to forecast growth in the health sector. What risk are we looking at in the use of AI? Just like the title of the work, the pros and the cons. So what are the risks we're looking at? AI will involve us learning new skills, will be required in the operation of the technology, and there is possibility of having false positives and negatives. There could be system error, and when we see that we've been using AI and has been successful to some time, we could have over reliance on the technology, on the AI technology. We could also have some cases of unexplained results. And there could also be unclear lines of accountability. There could be network system vulnerability to attack and hacking, which we have seen in other sectors like the financial sector. And there could be the fear of computer taking the work of men and of humans, and such could lead to job displacement. And there could also be threat to privacy, as we know that issues regarding health should be of private. But with AI technology, computer hacking and attack, there could be hacking where people's privacy to their health issues compromised. Now there are some ways in which we could lessen the risk involved in AI technology by seeking training in the use of AI and adhering to the standard protocols provided by the device company that has given the technology. Training will also enable physicians to fully and clearly articulate the potential harms to patients in order to obtain true informed consent, as we know that we can't always have positive, there will be negatives. So we need to train our physicians so as to minimize the error. Now the knowledge of artificial intelligence will also be integrated and incorporated into the standard component of medical education, since we'll be using that in the healthcare. We also need to understand that hospitals and other practices are also key to ensuring proper development, implementation, and monitoring of protocols and best practices for the use of AI system in healthcare. What statistics from physicians that have used AI or that have been privy to the AI technology? 56% of physicians are optimistic about the use of the technology. 35% are already using the AI technology in medical procedure. 66% believe it will lead to faster diagnosis, while we also have other 66% who believe that it will be more accurate. These are overlapping statistics. Most researches were carried out in China, United Kingdom, and the United States of America. What are the likely challenges that we could face in Africa if we have to adopt the AI technology in our healthcare? Certainly, Africa will most likely encounter several challenges because presently the continent faces the debt of investment in research, acquisition, and the use of the technology, the paucity of specialized talents in the use of AI technology, the lack of access to global research. The challenging the status quo is another major challenge because we have a traditional way of doing things. So the use of AI technology will be a new approach to a traditional way of healthcare, which could be challenging. And regulations are not yet in place for the adoption of the technology. Then it's going to take time to adapt to the technology. And also we have a cultural mindset which could arise from skepticism through the use of AI technology in our healthcare practices. And we should understand that unless African nations actively drive the development of AI, African nations will never be able to leapfrog the global rivals. Conclusion: putting artificial intelligence into use undeniably seems to be the future of global healthcare, and Africa must not be left behind. However, AI requires development and knowledge of new skills and data quality awareness in order to obtain intensive data analysis. Moreover, insight into the technology can help researchers and healthcare professionals to understand and address the future of AI and its application in healthcare. These are my references, and thank you very much. Bye for now.